Today we're going to talk about gastrointestinal drugs and medications, and usually the first thing we think of when we think GI and gastrointestinal medications is emesis. It's probably our most commonly treated GI issue. Emesis, big fancy medical word for vomiting. So we vomit for a lot of different reasons. But we'll kind of want to focus you on that in the brain there is a vomiting center, and that is a medical term for it. It is the vomiting center. And we also have a trigger zone that can trigger the vomiting center. So we've got lots and lots of receptors in these areas, lots of things going on, lots and lots of things going on. And we've got things going on, in the stomach or in the GI tract, going up to the vomiting center, this trigger zone. Well, our anti-emetic drugs, or anti-nausea, anti-vomiting drugs, are going to work on this vomiting center, work on these in this trigger zone, in kind of different ways. We've got four primary ways that we can reduce vomiting, reduce nausea, kind of depending on the cause of it. One of the more common ones is Zofran. All right. As your 5-HT antagonist, remember that 5-HT receptors are stimulated by serotonin. So these are serotonin receptor antagonists. We can give Zofran to try to um, quell nausea, vomiting. We can also give antidopaminergics, so blocking some dopamine receptors like Phenergan, promethazine. Two others just to know about. We've got antihistamines out there. Meclizine is an antihistamine because there are histamine receptors up there in the triggering zone, the vomiting center, and we have anticholinergics. You might see Reglan out there. You don't see Reglan as often as we used to, even though it's anticholinergic. One of the big, really, really common side effects every time you take Reglan, this is going to happen. Side effect of diarrhea. So if we have nausea, vomiting, typically we don't want diarrhea. If they are having diarrhea, it's going to cause worse diarrhea. So Reglan worsens diarrhea, so you have nausea, vomiting, and diarrhea. You're not going to see Reglan being given. Side effect of diarrhea, and it just kind of loosens the stools up and causes a little bit more fluid loss. So Reglan, not as typically given for nausea, vomiting as it once was. You might see it be given for other reasons, but if you do see it, you'll see it in the hospital. So just kind of ask, what are they on Reglan for?